Yes, thank you so much, Zoe. I'm here to also present a work I did jointly with Zoe and our wonderful students, Larissa and Julia, but also with our partners in Poland, in the Netherlands, and again in Germany and the UK. However, and I think the story I'm going to tell today is a story about how policies, crisis mitigation measures, when they're implemented, and we understand that they can be ad hoc, however, when they're implemented in, I would avoid the word patriarchal societies, but we are still living in patriarchal societies where traditional gender norms and norms are just expectations about what's the appropriate roles for us as men, women, non-binary people are, right? When policy is implemented in this context, what does it mean? What are the consequences? And who bears the brunt of the implications of the policies? So if you were to take one message out of it, I think you'll hear a story of how the traditional norms got reinforced. But there will be some good news in it. And at the same time, I also believe that it's important to humanize the data that I will show. There are numbers. However, behind those numbers are stories. There is a story of Maria, for instance, a successful professional. COVID hit, she was sent home. In between her meetings, she had to take care of her kids. Not only take care of her kids, right? She also had to educate them full time for a long time. At the beginning, her partner stepped in, but once they realized that we're in it for a long run, the support kind of disappeared. So meet Maria. And then there's a story of Magda, a young professional who just graduated with a law degree, but there were no jobs, nobody was hiring. So she had to take the first job that came her way. And then there is a story of Simona, who didn't have a lot of education but managed to be employed at a hotel, but then the hotels were closed, right? People could not travel. So today, when you hear the date I'm going to tell you, the bigger question that we asked in this work package is whether these stories of these women are just individual lived experiences, or do they actually represent what women in the European Union and the United Kingdom lived through every day. And a bigger question, because we had the opportunity and the privilege to design some parts of this research after and during, after the project was funded, so when the COVID was officially over. So we were also very much interested in the long-term implications. So whether what we observed in the short term stayed with us. And particularly because we're also very much interested in intersectionality. We know that people don't experience reality the same way, and even among mothers, some had more privilege because of their social class and because of their available resources. I'm from the United States, so I know that we had friends with houses, and lockdown was just a fun run in the park, and the kids could just go and play in the backyard. But if you're a poor mom living in a housing project, and you have to be confined to one small room with your kids, and you still have to educate them, that was a problem. So intersectionality speaks to these different experiences, and what we were trying to understand, whether or not some groups of women were affected more. And finally, we heard the struggles of Maria, right, and other women that I spoke about at the beginning of my presentation. But did politicians hear them? Did politicians, when they were discussing crisis mitigation measures, for instance, whether or not to reopen schools, were these women heard? Were their experience represented? And I'll give an answer to that. So we'll start at the beginning. Again, today I'm giving you a bird's eye view. We have a report published on the website. We also have policy briefs, and I invite you to go and explore a lot of granular evidence. Again, take with you that this is just a bigger picture. However, to come to this bigger picture, we've done a lot of research. I'm a big proponent of systematic, not only storytelling, right, and putting faces to the numbers. I'm another big proponent of systematic reviews. So we did a systematic review of available evidence in the published research, and then we also looked at the reports to see what does the available evidence about women's experiences during COVID tell us, particularly in the economic sphere and in the family life. We also looked at the existing survey data because we wanted to see what can be already used to tell a story about women's experiences. Not a lot of data were available, but some research programs actually included some COVID modules. So we used the data to show you then the short-term and medium-term impact. And then we filled our own survey, and this is where we were actually able to get at the long-term consequences. And finally, we went to the policy debates, and we used what's in the social sciences is known as a most likely crucial case research design. What it essentially means that if we find evidence, if we don't find evidence in this very, very important case, then it's very likely that the evidence we're looking for won't be in other less related or less relevant cases. And in this case, we looked at school reopenings, because if the needs of women and mothers, and then single mothers and low-educated women would have been centered, we should have, found them in these debates. And this is where, because it's a mixed, it's a qualitative research, it's in-depth research, it only covers 4 countries, but I think some patterns are pretty clear. So, what was the short and long-term impact of COVID on women? Insights from the systematic review and from the available survey data analysis paint the same story. Paint the same picture, tell the same story. So in the EU and the UK, women did bear the disproportionate share of the economic and family impact. So women were more likely to experience workload reduction, furloughs, reduction in their working hours. And when the survey respondents here talk about the negative economic consequences of the pandemic, these are the consequences they're referring to. And there is a small but still gender gap there. What was also clear from the review of available evidence is that we see that instead of fostering co-responsibility in a society where we still have traditional gender norms dominate, instead of engaging men in the support, with household and care, women had to do the work and more work. And I will only briefly mention it. We did look at the gender-based violence, but generally there was very limited research. We knew, the UN reported that, it's common sense that, if you put people in one space, and that potentially it may be, some rise in gender-based violence, but very limited research, and very few countries, the UK dominating, was published. So in the long term, I have some good news for you. Overall, according to our survey data, there are no statistically significant gender gaps when it comes to long-term effects related to increased household responsibilities or career disruptions in most countries in the survey. However, we have 2 exceptions. We have Austria, where there's a persistent significant gender gap in the reported increased household task load. And then when it comes to Hungary, we have significantly more women who reported that they still experience career disruption. These are statistically significant findings. So what about the women, the different groups of women? The answer is yes, there is variation, and you probably would have guessed who suffered most. It was mothers. Women was children. So they had to carry forward the double burden of paid work and domestic care. Men without minor children were affected the least. And for example, in this graph, I would encourage you, I will encourage you to look at these numbers. For instance, before the pandemic, there was about 12.5% of women who spent less than 1 hour on childcare, and then it decreased to 10.5%. And for men, pretty much it stayed at 15%. And look here, we have a 4% increase in women who spend more than 4 hours on childcare. For men, it's negligible, less than 1%. The challenge also that for women who had less education, than most women, and also single mothers. For them, this additional requirement to homeschool the children was the most challenging. And then, when it comes to intersectionality and negative consequences of the pandemic, I think what's important is that lower educated women in half of the EU countries, not in all, but in half, and you see them here, experienced disproportionate negative economic impact of the pandemic. Fast forward, I don't have time. So the long-term intersectional impact on women is very interesting here. And I think, again, the good news is, overall, most people, both men and women, do not report long-term economic impact of the pandemic. However, it is for women who are, women who have higher education, with post-secondary education. For them, the impact is still felt. The career disruptions are still felt 5 years since the beginning of the pandemic. And it's relative to women with less education. And we can talk during Q&A of why that might be the case. And I want to finish quickly with political discourse, 1 minute. Generally, what we observed, the politicians did not hear women. In the discourse, very, very few segments were focused specifically on women or mothers or single women or lower educated women. Austria is an exception, but again, is an exception as in 19% of coded fragments actually discuss women and their needs and their problems. So we can talk about it a bit again during Q&A. Violence against women, that was very interesting for us to see whether or not anybody mentioned the increased risk of violence when they debated school reopening and how schools potentially can be a safe space for kids and teachers can also monitor exposure to violence. It was not it was not there in the debates. And in conclusion, and then we can talk about policy recommendations later, to tell you why that is a story about what policies implemented with good intentions during crisis actually did in a society where traditional norms were prevalent. Gives you, this is, I'm so sorry. You can't see very well, but the takeaway from this very busy slide is that people who still report that they have economic ongoing career disruption due to COVID-19, both men and women, are more in agreement with the traditional gender role statement that children are better off if women stay at home. So we do see this lingering, this is 5 years since the pandemic, the lingering effect on gender role attitudes. I'm going to stop here because I'm out of time, but I invite you questions and we can have a discussion during Q&A. Thank you.